Welcome to this week's edition of the Truth Podcast.
Good evening and welcome to the Truth Podcast. I'm Akin Sam, and this evening we'll be diving on things differently. But guess what? I'm not alone. I have with me.
Blessing Yogo. Hey guys, and happy Friday. It's always good to chill with you guys on a Friday night. Trust me, it's not just two of us this night. More will be uploading very, very soon. Last week we looked at the power of saying no. Boundaries without guilt. And we got a lot of feedback from our MVPs out there, and we truly appreciate you guys. Someone actually sent us a 6-minute feedback. Whoa, you can imagine. And trust me, we took all the notes down. And so if you haven't listened to that podcast, go right away and listen to it, okay?
Anyway, today we'll be diving into the health talk as we actually promised you last time. We said throughout this month of September, we'll be touching every single part of our health. But to get us started, we have with us not just a medical professional, but somebody who I think will be best introduced by Blessing.
Okay, so I'm sure you're wondering who the beautiful lady is in the middle of us. Yeah, thank God we have a lady today as a guest. Come on. We've had too many men in the house today. So I'm gracing you guys, the screen with so many ladies. So here we have a professional. She's a young lady. She's a pharmacist and is into health education. Yeah. Today she's going to be taking us on a very lovely topic. I'm talking about none other than Pharmacist Rhoda. Ndon, so good to have you here in the house.
Thank you.
This evening. Is there any other thing our guests need to know that I've not said about you? Please, you have the floor.
I think you said it all. The part that you said I'm an educator, I always believe that it's good to educate people with the little knowledge that God has blessed us with. So it's an honor to be here.
Thank you for the honor as well.
Thank you.
So many of us have heard about malaria, typhoid, fever or something, but have you actually heard about sepsis?
Well, that's a topic that I know we cannot handle ourselves. That's why we brought Pharmacist Rhoda.
Yeah, so today I'm going to be a novice. I'm going to learn too. So let's listen to Pharmacist Rhoda as she unpacks this topic for us.
Anyway, so let's start with the first question. Please, what really is sepsis?
Okay. So sepsis is called a life-threatening disease. This is because the body fights extremely against an infection. And the reason why we call it life-threatening because the person can die within few minutes.
Minutes?
Yes. No, not minutes now, but it depends on the body though. Some people's response to some invaders, although normally the research says that 12 hours. Okay. Within 12 hours, but some people cannot last up to that 12 hours.
Especially in Nigeria, by the time you have taken, gone for tests, gone for this, all the hours have even gone.
Or maybe before you go to hospital, they'll say, let's look for your folder, let's do this investigation. The person would have gone. So it's called a life-threatening disease because the prognosis, meaning the recovery rate, is usually low.
Really?
Yes. So some people can recover after some time, but they will die few years after.
Really? Even after treatment?
Yes. That's why, although the research still says that people cannot say, okay, maybe because of the sepsis, but most of them die few years after. So that's why it's called a life-threatening disease, and everyone should watch out to prevent it because it's a pathway. Sepsis don't just happen.
Okay.
Infection proceeds. Meaning that for sepsis to occur, there must be an infection.
So what kind of infection?
Okay,
the infection can come from anywhere. Infection of the lungs, infection of the body, like people that have wounds on their legs, or any part of the body, or even typhoid. Typhoid fever, it's an infection. Because one of the organisms that is responsible for sepsis is a bacteria. So wherever there is bacterial infection, it can proceed to sepsis.
So sepsis is like an advanced infection, sort of. So it comes from infection.
It comes from infection. Infection from the lungs, infection from the stomach, infection from the wounds, infection even from skin.
So this can happen to anybody?
It can happen to anybody.
So then how do you identify that you're probably having sepsis?
Okay, how you can identify it is there are some signs. Physically, you can see the person. One of the signs is low heart rate. severe shivering, low or high temperature.
Now,
Low temperature
some of
as
these
well.
things you're actually
Yes.
telling me. Sometimes you might actually experience them with typhoid and malaria.
Yes.
No, it's okay. Before you can say that this is sepsis, you can get like 5 of those parameters before you can take it as sepsis. One, the low heart rate,
Okay.
the low blood pressure, the excessive shivering, extreme pain in the muscles. Those are all symptoms of sepsis.
Now, this pain in the muscles, like you said, does it refer to just one part of the muscles, or like say your hand muscles, or the entire body?
It can be one part, it can be all parts. Because like I said, sepsis is fighting an infection, and the reason why we say it's life threatening because it prevents blood flow to certain parts of the body. So when there is no flow, that pain will come.
Okay.
So the pain can be on maybe the right side of the body, or it can be on the left side, any part at all.
So how would you differentiate this? Because in Nigeria, the first thing, like let's bring it back home. When we have fever, like all the symptoms, or most of them, would naturally just go get over-the-counter medication, or just do typhoid and malaria test only. So when do we know we need to take an advanced step beyond?
Okay. One of the
Usual.
things is that there is what we call risk factors. Risk factors means people that are more prone to this kind of infection. Like people that are hospitalized. If you see someone that is hospitalized, maybe for a different medical condition, and all of a sudden start shivering, start having a low BP, low heart rate, and all these other symptoms I mentioned, is already an indication that the wound is already going into sepsis. Or someone with a weakened immune system, people like HIV patients, people with liver diseases or cancer patients, their immune system is already weakened. So sepsis, when it just shows, it projects immediately. So people in that category, or people that are on certain medications these days, with our Nigerian practice, when people can just walk into any pharmacy and get any drug, there's this drug called a corticosteroid. It reduces the immune system's ability, and people take it just because they want to gain weight.
Yeah?
So, yes.
Really?
Yes.
In this Nigeria,
yes,
people want to gain weight.
People take it a lot to gain weight. So by you taking it, it suppresses your immune system. So any of this infection that is coming around will just weaken it, and the symptoms will just be so glaring.
Okay, so I'm going to ask this question because I know we are kind of still in the rainy season. And being that we are in the rainy season, we've realized that people with a particular genotype are often falling sick this period. Does that not increase the rate of sepsis, most likely?
Or the infection advancing more in their life.
Yes, it can.
cases.
That's why one of the precautions during rainy season is proper hygiene. Because pollens and all these other agents that are more prone, they reproduce more during the rainy season. So if you come in contact with surfaces where these pollens have stayed, you have already contacted the organisms, and as such you have introduced infection into your body. And when the infection is introduced,
Sepsis.
the next thing is sepsis if the infection is not properly treated.
Okay, let's get very practical. Let's say now somebody is sick, or someone has, or you like a novice, or you suspect maybe sepsis. What are the measures they should take, like from the beginning to the end, basically?
The first thing to do if you suspect sepsis, call for medical attention immediately. But in Nigeria, where we have lots of things, one of the things I will even advise anybody, if you can get an ambulance, get an ambulance.
Really?
Yes,
Wow.
get an ambulance that will convey the person to the hospital immediately. Then while you are waiting for the arrival of the ambulance, check the person's temperature. If the person is running temperature, administer paracetamol and make sure the person is comfortable. Don't put the person in a choke room. Let there be air circulation. Let the person be comfortable and observe the person's response. Then when you get to the hospital, tell them everything that you've done. If you've given paracetamol, tell them you've given paracetamol, how many tablets you've given. Because I've seen cases where some people were trying to manage the situation, then now gave an overdose of the medication, so that when they now later got to the hospital, they started looking for an antidote
For the
overdose. So that instead of you to manage the sepsis now, you are now trying to manage the overdose of the drug that you've given. So whatever it is you've given, if you gave tablets of paracetamol, say you gave 2 tablets. If you gave 3, say you gave 3, so that the next person that wants to take over the management will know how to tailor the management procedures.
I can shout to when you get to the hospital, because it's
Yeah.
Naija. Because when you are speaking like emergency, clear for me.
Okay, so now coming back to the fact that we are in Nigeria, what are the challenges particularly that hospitals face in diagnosing this?
Yeah, because I'm sure there are deaths.
Yeah.
I'm sure the death rate is high
lots of
because
death rates.
there's some careless.
I think one of the major problem with Nigeria now is late arrival. Some people bring patients so late to the hospital, and then self-medication. Some people have infection. I had a case like that recently. This guy had an infection on the leg. The infection was not going after 2 weeks. I was already scared. I said, this infection is not going. Let's change the hospital. The father said, no, please come to the village. Let's do herbal.
That's one.
Let's do herbal. So I was just praying to God. He said, no, that this is he stepped on, all those beliefs that he stepped on something
charm
that
or
thank you, that he steps on
yes.
something. But the long and short is we're just praying, let this not go into sepsis, because if it goes into sepsis, it's going to, because sepsis are in 3 stages. It starts first with sepsis, proceed to severe sepsis, then to septic shock, then death. Because when there's septic shock, all the organs have failed. Means the liver is no longer working, the kidney is no longer working, the lungs are no longer working, so the person will not be able to breathe well. So those are the stages. So I was just praying, let this guy's leg not proceed to sepsis. So those are one of the things we see these days with people projecting herbal medications or religious belief of not going to hospital at the time they are supposed to go to the hospital.
Okay, so with this particular example you've given now, it brings me to ask this question. How do cultural belief systems affect treating sepsis? Because, like you said, the father asked him to come back home so that they can actually, go traditional.
It's still the same. Like some people, if they have malaria, they'll say it's from the village.
Village
That
people.
Yes, if they have malaria, they'll say. I know someone that had typhoid. The typhoid now proceeded to complications. Why? Because they said the woman was supposed to perform some rites and she didn't do it.
So you're not affected.
Yeah, so that's
So the spirits have come to.
Thank you. So until she goes back to perform that rite, and that's how that boy. Because she married, but they said she married. There was something she was supposed to do as she remarried rather.
Oh.
So there's something she was supposed to do before going into the new
married,
Thank
and she
you.
didn't do it.
So as she didn't do it, that's why the boy had that thing. So, but the long and short is the typhoid proceeded into complications, and the boy died.
The boy died.
Yes. So those are some of the beliefs that affect people seeking medical attention in the hospital.
So this sepsis causes damages, because that's what causes damages to the organs,
That's why
the
it's
liver.
called a life-threatening disease.
Wow.
Because the bacteria that I talked about will enter the bloodstream, and when it enters that bloodstream, it affects the function of every other organ in the body.
Now, because of the fact that I understand that
It's scary.
sepsis is not really taken note of so much in this part of the world, are there organizations that are pushing for this?
Like some awareness,
Yes,
right?
awareness.
Like what we're doing right now, the Truth Podcast.
This is still part of it. Like in the hospital, before anybody goes to surgery, they administer antibiotics.
Oh, so with the simple
Yes.
antibiotics, this whole thing is gone.
Like in the management of sepsis, antibiotics is the number one. Because like I said, it's caused by bacteria. So antibiotics is the number one treatment. So before anybody goes into surgery, an antibiotics is administered, and immediately after that surgery, an antibiotic is also administered. This is just to prevent sepsis.
Okay.
So okay, this is really cool. So by chance, I know we're not allowed to take self-medication, but if you have tried malaria tablets and typhoid, can we take antibiotics?
No, that's if there is need. But if there's no need,
Well, you don't know.
that's why you need to do lab investigations
Okay.
to see if you really need it. And also sometimes go for culture and sensitivity, because you could be taking, let's say, drugs like amoxicillin, and the organisms in that is implicated there is already resistant to it. So meaning that
It won't even work.
it won't
Telling you.
work. So meaning that as you're taking that amoxicillin, you're just wasting your time until you do that culture sensitivity to know which organisms which drugs can kill that organisms. You're just wasting your time.
Wow. Well,
Wow, amazing.
So now I'm going to come back again. Are there organizations that are responsible for probably creating awareness for sepsis around us here in Nigeria?
Because I'm sure people have heard
Yes.
about. I've not heard about this, truly.
I've seen one, especially but it's not that popular like that. Like in hospitals, like many hospitals, like big hospitals, there's what is called the infectious clinic center.
Okay.
And those centers, what they do is that they do periodic trainings just to tell people, okay, if there's an infection, this is what to do. If there's this is what to do. Like recently, someone called me and said he had a prick on the hand. He doesn't know if the person that he injected has an infection or something. So, but if this kind of awareness or knowledge is being created, you will not have to panic. You know the next thing to do. They always display numbers of the various people to call in case you need a medical emergency. So that's the one I know for the organizations that create awareness.
So, what of the government policies? Do you have an idea if there are government policies in respect to tackling sepsis?
Sam really wants everybody to be
because
involved. The NGOs, the government, the hospitals.
Okay, for government, I can't say for now. But those days, I remember when I was doing my internship, they used to release some antibiotics to teaching hospitals then, so that at least for the masses that can't afford, they released, some NGOs just released. I know there was a time they brought a truck of antibiotics, different classes, so that at least anybody, because just like I mentioned, you being in a hospital, you are already at a risk of developing infection that can proceed to sepsis. So they just release these drugs for people to have access to, because in our world now, so many people cannot even access simple medical treatment, not to talk of getting money to buy drugs. So I don't know if that's still in practice. I'm not in the government setting as now, so I don't know if that's still okay.
Yes. Mary, you have a question.
Mary. Good to have you here. I told you guys. I told you.
Good evening from Rhoda. Good evening, everybody. Good evening. I'm just listening to what our guest is talking about. Sepsis is really a serious conversation. It's not light. It's not light. I know one thing I know about sepsis because I've somehow, unfortunately, I've dealt with it personally. Not for me, but I had to take care of someone that had sepsis and all that, and I saw how their organs failed, and it happened in less than 24 hours. Every single one of their organs, from liver to kidney, lungs to their brain, everything just shut down. I saw it like real life. So I know sepsis is not an infection to be joked with, and I can tell that one of the reasons why an infection might just grow into full-blown sepsis might be maybe an infection or an injury that is not well taken care of.
Yeah.
And so this conversation is not this conversation is for everybody, because you don't know how you might just think that a conversation is, you might just think that, oh, this thing now is for big people, it's for a certain kind of people, it's for I know it's easier for a younger person to fight sepsis, right?
And the elderly.
Yes, their immune system.
One of even the risk factors again that I didn't mention is elderly people that are at risk of getting infection because of a weakened immune system. And some of them already have chronic diseases like diabetes. So that's one of the.
I told us that Mary is very passionate about this topic, and we can see why. I can't imagine taking care of somebody whose organ, you're just helpless,
Very
and
helpless,
24 hours,
very
just helpless.
Yeah.
Something that antibiotics and
See,
would
I said
have
before all the blood result came out, the person was dead already.
Oh my!
I'm telling you, blood from clotting profile, blood white blood cell, and all the before all the results came out. In fact, when the the laboratory people, when the lab scientists, when they were reaching out back to me that, oh, these are the results, I'm like, I'm sorry, we've lost him already, we've lost the person already. It's such a huge thing. You will, in your head you're thinking, but they're giving this person antibiotics, they are doing like everybody is running heter to help the situation, but it just looks like a situation that is not entirely help, like not like people are helpless. So of course it depends on their but it looks like I feel like another thing is, I don't know, but as a pharmacy, maybe you just, another thing is, it doesn't show like immediately. It takes stages. Maybe start from headache, the person start feeling like, oh, malaria, they feel like, oh, this might be malaria, and then you just keep growing like that. You might just think like it's normal body pain, normal system just not feeling okay, and then it graduates into full-blown issue.
Like one of the things I was mentioning, I said people that are hospitalized, some people that are hospitalized, they have to use what is called catheter, to pass their urine. So that catheter alone is a channel that makes them prone to getting infected.
Hello.
You understand? So with that catheter, or someone that is using a respiratory aid, that external device will even proceed to the person getting an infection.
Now imagine if the person already
had an infection, that it will even worsen it. That's why most times if people have sepsis, they don't put them in the normal ward. They put them in ICU.
Okay, yes.
That's intensive care unit.
Yes.
Where, like I've worked in intensive care unit, you don't even sleep, because as you are just trying to blink your eye, someone is gone.
Is dying.
So just being there, they are under, and even if they leave, they call them. And there's a in teaching hospitals, like the place I did my internship, when you are better from ICU, they take it to another unit called high dependency unit. When you are there for some time before and you are certified better before they can now proceed you to the ward. And so research have also shown that people that survive from sepsis, they don't allow them to go home immediately. They'll allow them to stay in the hospital to see that they go through some monitoring and all, so that now your organ have already so that you can be coming back gradually. So the organs will start responding gradually before.
I have an extra question. Is it? I know I have to search as someone that did with dealt with this thing firsthand. Is it contagious? Like, is it something that can be transmitted?
No,
Praise the Lord.
Yeah.
I know. I'm telling you, I need to ask.
I'm looking at somebody close to me.
I'm telling you,
these are the
I was
issues.
in direct contact.
No, you know what I'm asking? Because this got so bad that this person, my loved one, very dear to my heart, was actually what's
nose bleeding.
Yes, bleeding. Was bleeding from the nose, from the mouth, and it was a constant. No, this bleeding I'm talking about is not like bleeds 1 hour then 5 hours later. No, this bleeding is actively bleeding. And then I remember the nurses saying something like, "Oh, you have to. Oh, this I know. Yes, that I know. This is your loved one. Like this is your father. Kind of like I know, but you have to really wear glove and cover out and all that." It never occurred to me, because you're dealing with your loved one. You just feel like everything goes on. You just be rubbing them to yourself, dragging them to, I mean, that's for me. Cleaning everything, sure you're doing everything because this is your loved one now. Until when the nurse told me that, I now had to, I'm like, are we here? Like, has it gotten to this point where I have to now be protecting myself or my loved one? And it was such a heartbreaking moment for me.
But did you protect yourself?
She did. That's what she did.
I mean, I did not.
Please, let's know what
I did not actually.
No, but it's not contagious.
It's not contagious.
But just like you said, it's not contagious.
The organ is,
it's not contagious. That's what they will say.
Infection is contagious, but sepsis is not. That's why if you use a dirty toilet or you don't practice good hygiene, those are ways in which you can get infected. So
sepsis
so just prevent
sepsis
infection.
Is your own. That's the definition. It's your immune system trying to fight the infection.
Oh, so
So
it's
it
even
comes
the
from
immune
you,
system that's causing the sepsis.
because God did this body in such a way that when there's an invader,
Yes.
the body will try to mop out some things to flush it out. So, but the sepsis happen because the immune system is overreacting.
Hey, wait.
Yes,
So that
overreact
overreacting
actually
is what shuts
shuts
the system down.
like fails all the organs.
Oh,
all
Anyway,
the system down.
Sincerely, it's been an interesting topic.
Yes,
Honestly.
We've learned a lot from Rhoda. It's been lovely having you. Okay. On the 13th of September is actually World Sepsis Day.
Yeah, so we thought to bring this podcast to you to create awareness to support this. So don't delay. Share this podcast to your loved ones. Trust me, you'll save a life.
Anyway, continuing on this health talk, from next week, we also have another health topic for you.
Yes.
Yes, from next week we are having we've already promised you that we're going to make sure this month is all health talk. So we are going to come with should we do PC? No, we see we can
It's
bring
PCOS.
anyone.
PCOS
We don't-
can come last.
No,
Please,
we can
what's
do
PCOS? Can we
last.
just give them? Because you guys are, even when I heard the sepsis, now it's PCOS. Please, can you just give
Okay,
our
we'll
listeners
start
something
from
to expect?
Mrs. Sio before I get to that place. So we start from sickle cell.
Yeah.
I think we'll just do sickle cell, and then we'll also touch. I was even hoping that we actually touch blood cancer. I don't know, blood. We could touch something on blood cancer, sickle cell, blood cancer. What else again can we touch? Because it is a lot, actually. It's a lot.
Yeah.
So, but majorly, next week we are going to be talking about sickle cell awareness. I know we've had conversations on this for like a long time. People have been shouting it, but one more talk will not kill anybody. Let's just hammer
Yeah,
on it
because
one
this
more.
is the month for it.
Yes,
so we have to honor
we'll hammer on
those
it, yes.
that are living with this and actually create more awareness. Just
Yes.
3 days ago, we talked about suicide, where we acknowledged those. It was World Suicide Prevention Day. And I hope that all of us out there are showing love. We're not stigmatizing anybody. We're connecting, because these people need a lot of connection. So before we leave, as we round off, Rhoda, it's good to have you on the show. I
Thank
don't know
you
if you
very
have
much.
any last words to tell our listeners out there.
Okay, the last what I have to say is that always report to the hospital. I know we live in a world where so many people are scared to go to hospital because of the bills, especially private hospitals. You can also look for a hospital that you can afford instead of shying away. It's better to avert the situation early. It preserves lives.
Please, before you say anything, I just so the theme for this year sepsis day is 5 facts, 5 action. 5 facts times 5 actions.
Okay, what are the
That
5
just
facts? I
no,
want
like
5
they,
actions.
they are not listening that, but what I'm
Okay.
saying is 5 facts times 5 actions. When you hear this, it just means like it's a
Multiply,
quick
yeah.
quick thing. Like it's not something that
You
I'm
have to
just
sleep over.
just the way you're saying that hospital is the private hospital. If people find it difficult to go to the hospital and all that, but this year's theme is 5 facts times 5 actions. Like if you feel anything, quick
Action.
action.
Anyway, I'm feeling a lot of things right now. So it will be me saying, have a lovely weekend.
Bye, guys. Enjoy your
Bye,
weekend.
people. Bye.
Thank